Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I'm here with one of my wonderful patients here at Caring Medical Florida, Katherine. Now, Katherine, you were coming in today for your 6th visit, right?
Right.
And you guys live where?
North Carolina.
And then the reason why I thought it would be a good interview for us to interview you is that, you basically said to me the main reason why you came in, which was nausea and different symptoms, they're significantly better. So maybe you could just, tell your story. Like, what symptoms did you have, and then why did you choose to come to Caring Medical, and how are you doing with the curve correction and the prolotherapy?
Sure. So I came for neck pain and also nausea and problems with my stomach emptying food in a timely manner, so created nausea. And
Were you ever diagnosed with gastroparesis?
I was never diagnosed.
But you thought
with
you
it.
had that. You thought you had
I
it.
thought it was possible.
Yeah, okay.
And had some numbness into my fingers due to the cervical instability.
Yeah.
So all of those things have improved since I started.
Tell us about the stomach issues or the food issues, and how bad was the nausea? Did you have vomiting, or how often were you nauseated?
I was nauseated maybe 50% of the time, and it felt like food would be stuck in my esophagus.
Okay.
And so that happened quite often. And
You never upchucked the food.
No.
But it was almost like the food just sitting there, and while it's sitting there, the nausea would build. So did you have to be
Yes.
really careful with how much food you ate?
Yes, and I changed my diet and things like that. And, all of those things have helped, but definitely the nausea is gone.
And
And
before it was like horrible, right? Like,
Mm-hmm.
I mean, you're sitting here being neutral about it, but it was horrible, right? Like,
Right.
I think of all the sensations that I've experienced in my life, the worst one's nausea. Like,
Yes.
nausea is just,
Yes.
it's awful. So did you see other doctors before you came here for the nausea?
Not really.
Okay. So
It
what made you
was-
decide to come here?
Mostly for the neck pain, and I thought that there was some nerve involvement, and so a friend had recommended coming to see you because they had been helped.
Did you think that the treatment here was going to help your nausea, like before you came, or that was just something that I mentioned when?
That's what you mentioned.
Wow, that's really
learned that from
interesting.
you.
Because people do come here just for nausea, vomiting, digestive things, constipation. Mm-hmm. So wow, that's like a surprise, isn't it? Like,
Yes.
aren't you happy?
Yes, very happy.
Did you gradually get better with prolotherapy and curve correction, or was it all of a sudden stuff was gone?
No, I gradually got better.
Okay. So tell us how you're doing now. You and I
So-
talked about maybe this would be your last visit.
Right.
Are we
So-
still? I mean, you're going to basically divorce me after today, aren't you? But we're still going to be friends,
We're
right?
friends.
Okay. But I'm never going to
We'll
hear
always
from
be
you again.
friends.
But yeah.
No, I'm very grateful, and you've really helped tremendously. My pain is nearly gone, and my symptoms have been relieved, and so I'm very pleased.
You know what? You said something to me. You said, I've made a bunch of changes. So I thought it would be interesting. Tell me, because you and I talked about that prolotherapy is going to keep you well as long as there's reasonable forces on your neck. But if you get back to being addicted to your cell phone, and I said, in the room, I said, God didn't make our neck with really big muscles like a horse or something, or an animal or a lion. Like, we have dinky muscles here. So we were never meant to be looking down all the time.
Right.
So tell us like what sort of changes have you made since starting here?
So I've made certainly some dietary changes, anti-inflammatory diet, which is helping with the healing for prolotherapy. And I also do not look down at my phone. Try to look up at it if I'm looking at it. Less screen time. And
Did you raise your
I
computer?
raised my monitors at work.
Okay.
So
How about
that
your
I'm
sleeping
looking up at-
position?
Primarily, I still sleep on my left side.
Okay.
But
'Cause you know how some people, they're in bed, like, you know,
Yes.
they have the pillows and they're like this and they don't realize, boy, you're making your neck worse just by your sleeping
so
position.
you had told me my first visit to sleep on my left side just because
The
the
jugular
draining was better.
Jugular veins were more
And
open.
so I still do that, and I put
Okay.
it back a little bit. So
So, you know, you had to go through 5 prolotherapy sessions. So is it rough or what, how would you describe it?
no, I don't think it's rough. I have a little pre-treatment and the gas, and that helps tremendously. And you're so good at what you do
Oh, thank you
that
so
I
much.
trust you entirely.
Thank you so much.
And so it's very quick and virtually painless to me.
You know, over the years, I was just thinking of something. People would come to see me and they'd say, Doc, I'm just telling you, you get me better. There's 10 more friends and family that will come to see you. And it's been interesting to me that I'll get referrals like from people that we've helped, but it's amazing how even if your life's completely changed, it's not so easy for you know, a friend of yours to come in. So what's been your experience? Because obviously you have friends, you have family, and you're explaining your experience. Like you have some chronic things, you have numbness, tingling, pain, nausea, sticking, like the sticking, you know, the
Yes.
gastroesophageal sphincter now is working and it's resolved. So how has been their response? Like how has been their response? And do you think some of them have neck instability that need treatment?
Yes, probably.
Yeah, so explain that just a little bit.
So they think it's amazing
Okay.
because I'm enthusiastic about the results
Okay.
and how much different the symptoms are, and so they think, oh,
Okay.
you know that.
So you think they're pretty open to it, or they're open-minded?
I think they're
Okay.
some of my family, you know, somewhat open-minded about it, and
It's a
maybe
lot like
thinking twice.
It's a lot like any truth. Like there has to be people that speak the truth, then somebody hears it. So like for the first time, they might have heard the word prolotherapy. So it's like, you know, the Bible talks about planting seeds. You know, so you know, all of us that want to try to make the world a better place, you know,
Yes.
our job is just to, in a loving way, speak truth, and hopefully some of the seed goes on good soil, so there's fruit. But
Yes.
yeah, because over the years, I've even had friends who had surgeries that I knew the prolotherapy could get rid of it, and you just gotta like, you know, just speak the truth, and whether somebody, you know, because you know you're gonna
Yes.
meet family members and friends who have migraine headaches, dizziness, fibromyalgia,
Yes.
you know, diagnosed with chronic Lyme, mold toxicity, all kinds of different diagnoses, Meniere's disease. And then the problem is actually cervical instability. And the key thing, which you probably knew this, was if somebody has clicking, popping, grinding in their neck, and they got these weird symptoms, it's probably ligamentous neck instability that's actually causing the dizziness
Yes.
from the Meniere's or...
Right. And I learned that from you. And so I can kind of see that in other people. And I'm a nurse. And so I can see that in patients.
Oh, you're still working as a nurse? Okay.
Yes. And I have told some of my patients.
Appreciate that. Thank you so much. Well, you ready for your last visit?
Sure.
Okay. Thank you for sharing your story.
Sure. Thank you.